I was 38 weeks and 3 days pregnant, and I had started having contractions the night before on July 18th, 2018. When they first handed him to me, it was different than my other 2 pregnancies because before we had known the genders, and this time it was a surprise. And so that was really neat and special for the 3rd time because they put him on my chest and then Kevin got to tell me that it was a boy. I held him for a little bit and then I tried to feed him for the first time, and I noticed that he was having a little bit of trouble swallowing and breathing, and so I called a nurse back in and they suctioned him out a little bit more, and she did an evaluation and she brought him over in the bassinet, had him swaddled, and went to pick him up to give him back to me. She paused with him mid-air and said, she was like, "Do you mind if I take him to the nursery for a little bit more evaluation because he looks a little blue across his nasal bridge. So I just want to check. I'm sure it's nothing." A couple of minutes later, I said, "Kevin, go with her, see what they're doing because we don't know what's going on." He came back a couple of minutes later and said, "I can't watch." He said they're just moving him from machine to machine and they're nervous and they look worried, and so I can't watch. And so he came back and we immediately just started praying.
When something big happens, it changes and things aren't the same after that. And I knew that was one of those moments where I was like, not only to have a 3rd kid, something has totally changed in my life.
Canon was in the NICU and we sat there and waited. The door opened to our room, a neonatologist and a pediatric cardiologist walked in. And as soon as they walked in, I knew something major was wrong. After surgery, it was hard seeing him, and thankfully we had someone warn us that he wasn't going to look like our baby. I had given them a pink baby, and when he came out, he was blue. He didn't look like our baby, and so that was hard.
I love you forever. I'll like you for always. As long as I'm living, my baby you'll be.
Canon is now 16 months old, and he is the happiest, most joyful little thing. He's tiny, but he is full of life and probably the happiest of our 3 kids. We are fortunate that right now we have a pretty normal life. There's days that we forget, that Canon has a special heart and that he has an AD heart defect. We are thankful that he's doing so well. Although Canon is doing well right now, we don't know what his future looks like, unfortunately. We know he has 1 more surgery. There's a lot of scary things that can happen to his body after that 3rd surgery.
When I see Canon's scar, it just reminds me how challenging his life has been at a young age and how scary of a situation he's been in and how challenging his life is going to be in the future.
It's just so important that the funding for research just keeps on going and to actually hopefully one day come up with a cure, and so we can prevent this from ever happening to other babies. Without the research that the American Heart Association has already done, there wouldn't have been all these tomorrows for these kids.
My hopes and dreams for Canon is that he's able to have a full and happy life, and that he doesn't allow having congenital heart disease stop him from doing anything he wants to do.
What do you want to be when you grow up?
A baby heart doctor because Kenny is a heart baby. And I want to help other babies just like him.
There's times, obviously, when I'm frustrated or super tired, but then I just think about that it's another minute with him. And so it just warms my heart, makes me so happy and thankful that he's here with us.